It's a project aimed at investigating the impact of the COVID-19 pandemic on Black communities. A University of Toronto professor is at the helm of a national survey asking those of Black or African descent to share their experiences. Its data, she says, is sorely lacking and ultimately costing lives.
Race-based data wasn't something that was put on the agenda for public health or the government. And as a person who's been involved in community health for many years, it's something that I said, you know what, I'm actually tired of talking about it and asking about it. Let's actually collect our own data.
Roberta Timothy is principal investigator on the Black Health Matters COVID-19 project. The main component, a comprehensive survey that asks respondents not only whether they had or know someone who's had the virus, but how it has affected their finances and their mental health. There are also questions about whether they've experienced anti-Black racism.
I really hope that, that this project does is that it creates a voice for people who feel like they're not being heard, and also that action is done, action is done differently to support better health for Black community members.
Advocates have long been calling for the collection of race-based data in healthcare, even more so now amid the COVID-19 pandemic. Some public health units in Ontario, including Toronto and Peel, began collecting this information last spring, and it revealed what many had expected, that COVID-19 disproportionately impacts ethnic and racial minorities. As of November of last year, Black patients made up 16% of cases in Toronto, while only accounting for 9% of the population. Dr. Tito Dowdu, a pediatric surgeon in Calgary, is one of the many who have spoken out about the damage of not having these statistics on a national level.
I always want to be careful that when we talk about race-based data, we're not thinking that the reason these discrepancies exist is because of race itself, but really it points us to areas in our system that there is unfair treatment of patients. And if we can't even identify those areas and where they occur, then we have no hope of being able to correct them because we don't even have a starting point.
Timothy hopes her project can be a trusted starting point. While it's still early, she says anecdotally she's already identifying gaps in knowledge that she feels are not being properly addressed, one of the biggest being vaccine hesitancy.
There's mistrust regarding vaccines because there's a history of mistrust and a current day reality of a healthcare system that doesn't cater to Black folks.
The Canadian survey is just one aspect of the project. They will also be launching a global survey on March 21st to coincide with the International Day for the Elimination of Racial Discrimination. To take part in the survey or to donate to the project, you can head to blackhealthmatterscovid19.ca. In Toronto, Erica Natividad, City News.